Good morning, Dr. Gary here on the road. It is Sunday morning. We sell dental practices nationwide. Today's topic is seller complains of information overload requests. We'll get into that. So, as you know, we're now in 28 states selling dental practices nationwide. I was a dentist myself for 25 years, and now for the past 13 years, I've been doing the dental practice brokerage. We have 10 employees now, including 2 CPA accountants, marketing director, operations director, etc. So we have a great team out there searching and helping you sell and buy dental practices. Our phone number is 201-663-0935. Our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. You can reach us from 8 a.m. till 9 p.m. East Coast time. So just give us a call. We'll be happy to respond. We work 363 days a year. We take off Christmas and Easter. So we are here to help you in any capacity, buyer or seller. Now, if you're thinking about selling, and by the way, all this information is for entertainment purposes. It's not legal or business advice. If you're thinking about selling to a DSO, please call us because we have an intimate knowledge of them. We work with them. We know what their contracts are like, what direction they're heading, what their needs are, what it's like going to contract, how long it takes them to go to closing, which DSOs are having some financial issues right now. What are the sellers happiest with certain DSOs? We try to promote the best DSOs. We don't work for them. Generally, our commission is paid in full by the DSOs when we pull in a DSO. And when you work with us, often we will get your legal fees reimbursed upon successful closing. So please give us a call because we're going to help you out. Anyway, so what is this information overload that the seller is complaining about? The average sale for a dental practice needs tax returns, procedure code analysis, profit and loss, discretionary expenses, leases, W-2s, practice provider code, that is who produced it, practice statistics by the ADA code. So it's called practice analysis, demographic reports, etc. That is your average list. And some sellers do get overwhelmed. First of all, that all these requests are not put in initially by the buyer or the buyer's bank or the buyer's consultant. And then they'll ask for more information. And sellers, a lot of them may be somewhat senior or accustomed to buying a practice in the past, look at tax returns, and that was it. They didn't have to deal with all this data that's being requested now. All this analysis, all the procedure code analysis, procedure code by provider, procedure code by ADA code. They were not exposed to that. They were not required to do that. It wasn't even existed maybe because computers in dentistry are maybe 20 years old now. But when they were buying a practice at 30 or 40 or 50 years ago, that information wasn't available. So you have, as a buyer, have to understand that. But as a seller, it's a different market now. The banks have certain requirements that for data, their accountants need the data, the buyer needs the data. They want to analyze all the data and they want to see just what is going on with the practice. And often before they come and visit the practice, they're doing a cash flow analysis. And sometimes if it doesn't, in their mind, cash flow, they don't proceed forward with the practice. So this is something that you've got to understand, that there is issues here that is just different than it had been in the past. And the information overload, sellers get overwhelmed with all the requests for information. They just get totally hammered with it. And it's not easy. And it leads to frustration, and I call it information overload. But this is the situation as it stands. That bank's going to need that. The buyer's going to need that. The buyer's data-driven. Bank is data-driven. And the buyer's consultant is data-driven. That's how they make their decisions. Obviously, there's sometimes I look at a practice. I showed a practice just the other day in a densely populated area that it maybe only had 2 operatories, but there was room for the 3rd operatory. The buyer walked in. There's something very interesting. Now, this data that I'm about to tell you about, or information, it could be put on a spreadsheet, certainly. But it's how long have those patients been there? How long have they been patients of record? Where do the records go back? Now, you could produce this on a spreadsheet with the right computerized system. But when you walked into practice, all the files were on a giant, shelf. And some of the files were 1.5 to 2 inches thick. The buyer saw that, and this buyer, for example, said, wow, these are great long-term patients. And being the success of a dental office is 99.75%, as proven by records. The buyer saw the thickness of those patient record charts and said, I can't believe how thick those charts, how long these patients have been coming here. Now, certainly, many of the records now are paperless, and you can't see that visual, and you miss that. Yes, you could put this on a spreadsheet. Yes, you could see it on a document, on a piece of paper, but you can't, or on an email screen. But the effect of that visualization is very important. And then the cleanliness of the office, the appearance of the equipment, the visibility, patient profile type thing, and the staff is like, the feeling in the office. Some of that you just can't get from data, but the data is the main driving force. So, once again, sellers, it's unfortunate, but you've got to adapt to this. You've got to change and adapt, and just can't say, I'm only giving you my tax returns, that's it. Just can't do that. Unfortunately, I know what you mean about some of them. It could be a doctor that has certain disabilities and is just not marketing anymore and so forth. And that's why the practice is slowed down. But people don't want to pay on potential as much anymore. And you just can't sell it on potential. It's data driven. So you have to have a combination of convincing the doctor it's a great opportunity, bring him into the office, but at the same time, you've got to adapt and provide the information that is requested, that is needed, as frustrating as it is, and it just drives you crazy, these information requests. Or you give some data and information and it's not adequate, and they don't tell you it's not adequate, that is the buyer. Then they come back for more explanation, or there were a couple other pages of the report that you didn't think were necessary, you didn't send it, and they want to see that. So you've got to work with them. And you've got to just adapt for now, because you're selling the practice just once. And we'll help you as brokers, assist you in any way we can. We have certain methods. If you don't have the data, we have methods of getting that data on a day-by-day basis and cumulatively add it up, so we can help you with that also. So give us a call. We'll go over all these things with you. We have a bunch of new practices coming out. Now, you have to be on our special list. You just signed a non-disclosure agreement, and you'll get our list every 4 to 6 weeks. So just, try to grab that list, and you'll see just what's going on with new practices. All right, team, I'm getting ready for spring and summertime, and I am excited. Hope you're having a wonderful, wonderful time out there. Get ready for summertime. The beach, I am so excited. It is going to be great. And hopefully by January, February, March of next year, I'll be recording from warm weather climate. I'm trying to get down there in Florida for at least a few months out of the year. I'll talk to you. Bye, guys.